If you're sleeping for 8 hours a day, that's practically 1/3 of your life that you're spending in sleep. And not only the quantity of sleep, it's also the quality of sleep.
Have you observed that in terms of there's a difference between symptoms and diagnosis of sleeping disorders?
So the first fascinating aspect was there was so much to learn on the job. Then there was so much to teach on the job, and then obviously take the medicine forward.
What is first of all apnea is, and then if there are other such kind of disorders?
The most common one that we tend to deal and the one we were speaking about is called as sleep disordered breathing.
Does it impact their productivity? A lot of people say that, I sleep just 4 hours a day.
Very interesting about sleep is it's not an inter comparison, it's more like an intra comparison.
These kind of sleep disorder can lead you to even heart issues.
So we only know two reactions. One is flight, another is fight. So we can run from the situation or we can fight from the situation.
Welcome to Medical Value Talks, where we discuss about how technology, empathy and innovations are reshaping healthcare. And today is a very interesting topic we are going to discuss about. My wife says that I can do this anytime during the day, all day, anytime. It's not what you think, it's actually sleep. So today to discuss this topic, we have an expert in this field and my dear friend Dr. Sushant. Dr. Sushant Khurana is 20 years of experience in clinical medical setting. He has spent first decade as a clinical practitioner in Max Hospital and NHS UK, and after that he worked with various corporate including Boston Scientific, ResMed, etc. So with further ado, let me invite Dr. Sushant. Welcome Dr. Sushant to MVT.
Thank you so much, Nitin. Thank you for having me here. First of all, huge thanks to the entire MVT and RxOne team for bringing this MVT out there. Very, very important to discuss these topics. And taking a cue from your point, I wish everybody could sleep like you, but that's not the case, and hence probably the topic becomes a lot more important.
Absolutely. And then on the sleeping side, right? It's everyone think like they are sleeping, I think soundly, and their sleeping is not something to be bothered about. But what you have observed, how your specific journey as a clinician led to the sleep medicine?
So it's a very interesting topic when you think about it, Nitin. I think to put it out as a layman's term, just imagine if everybody sleeps for around 8 hours in a day, an average out, which hopefully a lot of people don't get these days, and hence the specialty itself. But if you're sleeping for 8 hours a day, that's practically 1/3 of your life that you're spending in sleep. But nobody understands the importance. It was always thought that it's purely to get you recharged, get function for the next day. But as the science has gone ahead and progressed, you realize how much more there is to your sleep, and not only the quantity of sleep, it's also the quality of sleep. I think we'll talk more about it during the session.
Right. But when you were practicing, as a doctor, have you observed that in terms of there's a difference between symptoms and diagnosis of sleeping disorders?
So my introduction to sleep was primarily through the industry. When I started my first stint with ResMed, is when my journey, so-called an exploration of sleep, started. I found it very, very fascinating in terms of this was one branch of medicine about which you're not really taught a lot during your medical school days. So even after doing your MBBS, your MD, you might not have been exposed to as much of sleep as you think that's required for probably a GP to practice it or another sleep specialist to practice it. So the first fascinating aspect was there was so much to learn on the job. Right. Then there was so much to teach on the job, and then obviously take the medicine forward. And I think that was the difference. So during my practicing days, I think in the Western world, sleep was much more integrated in their practice. They have MDs in sleep medicine, so they have sleep specialists who are MDs in sleep medicine. Right. Whereas in India, we typically do not have an MD in sleep medicine. But what typically happens is we have various specializations which have picked up sleep, obviously learned through and practice it. So pulmonologist practices, neurologist practices, some of the ENTs will do it. But on a holistic aspect, India would not have an MD in sleep medicine.
Right.
And that's where the gap and that's where the role of entire industry comes into picture as well.
Right. And interestingly, I think sleep, as I mentioned earlier as well, it never considered that there is a problem or people even won't recognize. For example, my family, find me if I'm snoring in my sleep, they say that, you were sound sleep, right? They'll say you are in deep sleep and that's why you were snoring. But later I realized that it's a sign or symptoms of a disorder.
Absolutely, Nitin, and that's why it's so fascinating. There are so many myths around sleep. When people just think that they are snoring, like you mentioned, they think they are in deep sleep, whereas now we realize it's a very, very specific sign for a disease called as obstructive sleep apnea. You would have another myth where you think elderlies don't sleep much at night, their sleep is reduced, but that's not the case. So if you see in the entire animal kingdom, how sleep works is, uh, sleep is polyphasic. When I say polyphasic, people get up, do their job, then tend to rest. People get up, do their job, and then tend to rest. If you see in the entire animal kingdom, let's say a deer would eat grass, run from the lion, and then try and rest. Lion would try and catch the deer, eat, and then try and rest. Whereas what we humans have done, specifically over the evolution with the electricity, with the gadgets, with the technology, the side effects of these things is we have shifted to a monophasic pattern, especially in our adult life, where you just sleep once and then you work the entire day and then you go back to sleep at night. Whereas in elderlies, it kind of goes back to a polyphasic phase. They'll try and catch up on a nap during the day. They'll probably catch up during the nap after their lunch. So they're still getting those hours, but those hours are now in a periodic phase rather than a continuous phase. So there are lots and lots of myths around sleep, and that's where the gap in terms of practicing sleep also is there, and that's where a lot of people never enter the diagnostic funnel and they're kind of missed out upon when we talk about diagnosing these specific sleep disorders.
All right. And when we are talking about specific sleep disorder, what are those? So you just, I think, briefly mentioned apnea, but what is, first of all, apnea is, and then if there are other such kind of disorders?
So sleep, IC divides sleep into almost 84 known sleep disorders, probably even more now. The most common one that we tend to deal and the one we were speaking about is called as sleep disordered breathing. That's the disordered breathing while you're trying to sleep. So it could be different patterns of your breathing, missing out on your breathing while you're trying to sleep. One of the biggest category in SDB is called as OSA, that is obstructive sleep apnea. How it's defined is basically when you're trying to sleep, when your brain is telling you to breathe, but you're not able to breathe because there is obstruction in the airway, and hence the obstructive sleep apnea, and hence the name. So typically happens is, just imagine while you're trying to sleep, somebody's trying to put a pillow on your face because you're not able to breathe for that particular amount of time. Could be 10 seconds, could be 15 seconds, could be even longer. So every time I put a pillow on your face, what the body tries to do is it tries to wake you up. And that's where your entire pressure, the negative pressure that is created while breathing, vibrates your soft tissue. And that is how the snoring happens. So every time you're having an episode of apnea, it could be linked to snoring. So to your earlier point, where people think that they're snoring and they're in deep sleep, they're actually much closer to death while they're snoring than actually being alive. So that's how fascinating it is.
That's actually scary, to be very fair. I think I snore a lot, and probably will get it checked. But in terms of, you are saying that those people who are not able to sleep properly, does it impact their productivity? A lot of people say that I sleep just 4 hours a day. A lot of influencers say that they maybe sleep 4-5 hours a day, but they are like doing great.
So again, two aspects to it, Nitin. One is, let's say people who are suffering from a disease, obviously, and we'll talk about how you diagnose OSA and treat OSA, have to kind of obviously see a sleep specialist and then get those aspects sorted. Purely in terms of sleep, when you mention people who think they're getting the time in terms of could be 4 hours, could be 5 hours, could be 6 hours. Another aspect very interesting about sleep is it's not an inter comparison. It's more like an intra comparison, and I'll try and explain it. So let's say if you're sleeping for 7 hours, doesn't mean Sushant also has to sleep for 7 hours.
Right.
The whole idea of you having a sound sleep and a qualitative and a quantitatively effective sleep is, let's say if you're sleeping for 7 hours, and if I can make Nitin's quality of sleep maintained and ours increase to 7.5, would Nitin efficient better than Nitin work more efficiently than what he was doing right now?
Right.
So that is how the sleep basically matters. So if somebody comes and say they function very well at 4 hours, The whole point is, let's say if they're able to catch up on our sleep for 4.5 hours or 5 hours, would their efficiency increase? Most likely the answer is yes. That's how the efficiency of sleep changes.
Yeah, but saying that, I heard a stat saying that 1 out of 10 Indians have some kind of sleep disorder. So if people are sleeping as per their requirement, why there is so many people having these kind of issues?
So very interesting, Nitin. So how sleep works is, for as layman or for even as a learned man who goes to sleep and then gets up, if he's not fresh, he thinks he has not slept well. But he looks at the watch and he says, I've got my 7 hours. I went to bed at 11, got up at 6. So I've got my quantity is fine. So, and that's where the role of a physician or a role of a sleep specialist or a clinician comes into picture, where you can actually analyze what was happening during those hours of sleep. So just manage, like I mentioned earlier as well, just managing those 7 hours or 8 hours is not the epitome. You basically need to look at the quantity of that sleep as well, or rather the quality of that sleep as well. So you could be getting your 7 hours, but let's say if you're getting up 10 times in the middle of the night, let's say you've known diabetes patients getting up in the middle of the night either to urinate, sometimes feeling thirsty and having water. So if your sleep keeps on breaking during the night, irrespective whether you've got those 7-8 hours, you'll never feel fresh.
Right.
And that is where the role of diagnosis comes into picture.
Okay, and actually all this kind of lack of sleep leads to various kind of other diseases. Diabetes is something you mentioned already, but I have heard that these kind of sleep disorder can lead you to even heart issues, right? So what do you say about those?
So very interesting, Nitin. And what has happened over the period of time in, let's say, last decade or so, the association of sleep with a lot of various other cardiovascular disorders, metabolic disorders has come in, and now sleep is kind of an integrated part of them. And that is where the interest in sleep has kind of catapulted to a next level, where a lot more people want to practice sleep, a lot more people want to go to their doctors. We see a lot of people tracking in various phones or wearables or other formats. So just taking you back to the same example and how it's associated with most of the disease. When the pillow was on your face, right, and you were not able to breathe for those 10 seconds or 15 seconds, the body tends to fight it, right? And body, humanly, we are still very primitive in terms of how we react to things. So we only know two reactions. One is flight, another is fight. So we can run from the situation or we can fight from the situation.
Yeah.
So every time I put a pillow on your face, your body thinks you're dying. The body gets into that fight and flight reaction, fight and flight reaction. For both the conditions, what you need is, you'll need more energy. Right. So your oxygen consumption would increase, your glucose levels would increase, your energy, you need more energy to fight or flight. Your heart would have to pump more blood, because obviously you need energy, the blood has to go to your muscles. Every symptoms or this physiological change that is happening at the back end kind of is related to the diseases that you talk about. So while you're sleeping and your sugar constantly keeps on rising to a certain level, the body thinks that's your new normal. And what is a rise sugar called as? Typically diabetes. Your blood needs to circulate more, heart has to kind of work more, heart has to pump more. So it keeps on giving increasing rhythms, whereas during your sleep, it should have been resting at a much slower pace. Now it's kind of fast, beating a lot faster, then slowing down, beating a lot faster. That leads to arrhythmia. Again, similarly, if you have a tendency of any kind of cardiovascular disease, all these things lead to increased catecholamines in the body, increased oxidative stress in the body, which are directly linked to your heart attacks or cardiovascular diseases. The blood that is being pumped by the heart to reach your various organs in a fight or flight case, since now the pressure is more, a constant pressure increase is called as blood pressure. So in a layman's term, how do you understand is, every time your body has to overwork while it should be resting. Just imagine a factory. In the night shift, the workers would be less, the production would be low. Now what you're trying to do is, you're practically increasing the production with less amount of people and running the factory throughout the night. Wow. It is bound to shut down at a time. That's what typically is happening in your sleep apnea.
That's again, sounds scary that it is related with probably almost all the diseases which is possible, right? So definitely as a layman or normal person, we have to take care of our sleep. But what you see as a trend in India, because again, coming back to the point is that probably sleep related disorder never seems like an issue. Do you see this trend is changing? People are becoming more aware and are going for diagnosis? Do you think that trend is changing now in India?
Trend is changing for sure, but we still are a lot behind in terms of diagnosing the people or bringing the people under that umbrella of diagnosis as compared to the Western world. Having said that, like I mentioned, in last decade or so, a couple of things have changed. One, for any disease, let's say not even for sleep, for any disease to work out well for the society, three things have to work out. One, the patient's interest. The patient has to realize he has a disease, obviously has to seek care for it. The physician's or the industry's interest, so that the physician looks after those diseases, industry produces stuff for those diseases or treatment for the disease. And when all these three things come together, the patient, the physician, treating physician, and the industry, then any science would kind of evolve and would kind of emerge successful in terms of giving you the results that you want for a patient or for the industry itself. And that has really changed in the last 10 years. One aspect is a lot of technological changes have happened. A lot more people are a lot more aware of their sleeping habits. Like I mentioned, they have these trackers, you have these phones, various things coming out. Sleep has now been seen as an essential aspect of your well-being, not only well-being, plus also your fitness regimes. Now I've also heard if you go to a gym and you ask them for a fitness package, they also monitor your sleep. They ask you whether you're sleeping nicely or not, because they realize as important as it is to work out, the recovery is as much important as well. So the entire outlook towards the sleep has changed, and that has also changed where it has increased a lot more people seeking help in terms of looking for diagnosis, looking or coming into that diagnosis funnel, reaching out to their physician. Having said that, there is a huge gap, and the gap kind of comes from the aspect that, one, there is a lack of awareness still. We talk about any tier 1 city, the awareness would be much better than a tier 2 or a tier 3 city. The second aspect is the clinicians themselves. Not all the clinicians in India, like I mentioned, would be well equipped to look at those symptoms,
Right.
identify those symptoms, channelize these patients into the right way or send them to a sleep specialist, because like I mentioned, the medical school really hasn't stressed that much upon sleep as a science per se, because it's a very nascent science in itself 35, 40 years ago. The third aspect is the education itself. One is where you are not aware, your clinician is not aware, and then you don't even know whether you're sleeping fine or not, what you mentioned earlier. So I get up in the morning, I feel fine, I'm having a little headache, could be because I worked too much last night, I was probably working on a presentation, I was looking Netflix at a later time, I'll catch up on the sleep over the weekend. And if you see a lot of the younger category, including us and probably the younger generation as well, they try to catch up on their sleep when they get a chance, right? So people tend to have those naps during the weekend and they feel very fresh because they're trying to catch up on the entire week's lag of sleep. If you've flown very recently, people on the flights would be like, you just sit down on a flight and you start hearing snoring from people.
Right.
Because everybody's trying to catch up on their sleep because they're lagging so much. So I think as the awareness grows, as people are more aware in terms of the effects of lack of sleep, I think the science will evolve per se. Because now as a patient, I'll come to my doctor and tell him, boss, I'm not able to sleep fine, and these are my symptoms, and this is what I've read of, this is what I know. How can you help me? And the doctor is more than willing to help.
Right.
The whole logic of not knowing the science and not knowing your symptoms just puts everybody in a blind spot.
I see. And so while we're talking about accessibility, what do you think on the affordability point of view? Is it something which is affordable in terms of diagnosis or even in terms of treatment? Or do you think still probably ecosystem has to evolve to make it for the masses?
A slightly sensitive one to go out to the public, but like I said, again, the three aspects match, right? For any therapy to be commercially successful as well, all the three components have to work. So awareness is one part of it. As a patient, I should know when I need help.
Right.
As a clinician, I should know when to treat that patient.
Right.
Once these two angles are working well, industry would be more than happy to do the research, bring out the products, because then it makes a commercial sense for them. Having said, what happens in India right now is, and very important point that you mentioned, sleep is still not covered under most of the insurance, most of the private insurance. And hence it becomes a little expensive therapy to to afford for a lot of our population, especially in Indian setup population. It becomes expensive therapy to it's expensive disease to diagnose, expensive therapy to kind of afford, and that's where another lack of management of the disease typically happens.
Right, right. But is there anything which industry can do? Maybe government can play, as you said, that insurance is something which is not covering as of now. And I believe few years back even dental was not covered under insurance. Very recently, I think 10 years probably, that dental has started covering, because earlier it was thought that it is more of an aesthetic value. Right, nowadays dental is also covered, and maybe future is that.
Absolutely, and like we've been discussing, once a lot more research happens, we've already found associations with diabetes, cardiovascular disease. Once you see their disease burden going down while you're treating sleep, and once the insurance sees how much money they can actually save on treating on those diseases, or governments can see the disease burden that they can bring down, that's typically when any therapy would flourish. Also, some of the changes that have happened in the Western world, if we see, earlier sleep was diagnosed purely in a hospital setup or a sleep lab. Then came a lot of home sleep testing, so just to give you a rough idea, let's say a sleep test in a Western world in a sleep lab would cost more than $1,000. Whereas when the home sleep testing came in, it came down to around $200. So a lot more people could afford it. A lot more people could, under their insurance, could afford it. Or a lot more people came under that umbrella of diagnosis. Similar trends are seen here as well. Now home sleep testing is evolved in India as well. You have various newer devices which pick up these diseases almost as accurately as a sleep test. And again, your clinician knows the difference when you need a sleep test in a sleep hospital or a lab, and when you can be easily diagnosed at home. So the clinicians typically know that difference, and they make that difference. And the benefit of the diagnosis then is obviously passed on to a lot more patients in such cases.
Right. And as we are talking about that, how even home care and such kind of solution can reduce the cost, what do you see the future of sleep medicine, future of the treatment of sleep disorder?
Nitin, sleep has been a very interesting journey. Like I said, it's a nascent branch that came up around 35, 40 years ago, but it has evolved very, very quickly. So let's say if I talk about, we can divide it into diagnosis and therapeutics in terms of the technology that you would see coming up. So when you look at the diagnostic aspect, like I mentioned, obviously moving from a sleep test to a home sleep testing has evolved over last 5 or 10 years, probably even longer in the Western world. And then the newer technologies in terms of you have all these apps monitoring your devices, you have your phones monitoring your tests, you have your Apple Watches or smartwatches monitoring your tests.
But how accurate that is? Is it already at that stage that it can?
So they are for certain set of diseases. So in fact, I was reading recently where your Apple Watch 9 and 10, and now the 11 is out as well. So I'm assuming it also covers it. They are FDA approved for diagnosing obstructive sleep apnea and screening sleep apneas. So they are that accurate. So like I said, technology evolves much faster than scientific medicine, sorry to say. So technology in terms of diagnosis has kind of grown leaps and bounds. Therapy obviously is following it. So all these parameters, when you start looking at these parameters, you start correlating it to your lifestyle, you start correlating it to your eating habits, you start correlating it to your fitness, you start correlating it to your annual medical bills. Sleep obviously now has kind of come in front. If we talk about therapy per se, the concept of therapy really hasn't changed, but therapy has evolved in terms of the devices that you used to use earlier and the devices that you use earlier. So for a sleep apnea patient, typically the devices that you use are called as PAP therapies, positive airway pressure therapies, in which, let's say, the air is blowing into your mouth and they're keeping your airway open because your airway was collapsing while you were trying to breathe. So a lot of research has gone into making the patient more compliant to the therapy. Now you have better devices. One, they are better looking devices. So one of the recent devices, if you put in the setup here, we won't even look at it as a medical device. They look like your either iPod song players or something like that. So they look that non-intrusive in your normal life. So you can use it in your living room, you can use it on your flights. So that's one aspect where it has evolved. The second aspect where it has evolved, like I said, making patient a lot more compliant, is the interface. So the masks have changed a lot. The material used for the masks have changed a lot. The pressure that you get for the devices have become a lot more softer, so to say, because the patient can easily take it.
Right.
And the other aspect that has changed probably on the technical aspect is the data that these devices capture now, and the data that the patient can himself see, the improvements that patient can themselves see on the data. So a lot of this entire ecosystem has evolved, obviously with the with the help of technology as well, and that kind of helps patient have an integrated part in its decision making and the lifestyle management, and that really helps him, because again and again we speak, it is not an infection that you'll take medicine for 10 days and then the medicine will go off. This is something that you might want to continue for the rest of your life. Obviously, the technology will keep on changing. So as a patient, I would want to be involved. If I have to use something, let's say for the next 30 years, I would want to be involved and see how my life kind of goes parallelly to with using that device. I think those things have really improved in the last 5 years, I guess.
Wonderful. And before we wrap it up, I want to again for you to advise some of the practical tips for our audience today.
So a couple of things, Nitin. One, like I mentioned, just to add a little bit on the last point, is when the technology is changing, one aspect that you see, especially on a lot of internet, is you have a lot of information. I think the challenge in today's age is how to filter that information and how you use that information. Especially in sleep as well, now you see a lot of stuff where you have these facial scans coming up, you have these biomarkers coming up which will diagnose, you have various newer technologies coming up, and all of that is great, and all of that obviously would see the day of light and would be used as we go forward. For a patient or for a layman, the idea still remains, once it starts giving that importance to the sleep, where it still recognizes or is able to recognize that if he's not sleeping or if he's not fresh in the morning, if he's having headaches in the morning, if he's more prone to, let's say, having road traffic accidents while he's driving, if he has uncontrolled hypertension, if he has uncontrolled diabetes, he should be able to associate in its head with the sleep itself, and then obviously reach out to the right person in terms of getting his physician, his sleep specialist, or any other person that he knows, so that they can guide him to the right channel and right treatment. The other aspect, a tip would be maintain a bedtime. I think we all are now culprits for this, where we're so engrossed in the technology, we still scroll that last screen before sleeping. We still want to see that last email before we hit the bed. We still want to get up in the morning and look at the notifications on our phone. Stay away from the screen as much possibly as you can. I know in our days, in today's world, it's very difficult and impossible, but still maintain that sanity. That really helps sleep much better, I guess.
Great. Thank you so much, Dr. Sushant, for valuable inputs for our audience today. Before we again close, want to quickly gain your thoughts around Medical Value Talks podcast. What do you think about this whole kind of discussion we are doing?
Brilliant initiative, so to say, Nitin, and knowing you from the RxOne team, the entire RxOne team as well. I think the point that I mentioned earlier, there's just so much information out there that it's so easy to get lost with the amount of information that is out there, and almost impossible to pick up what is right and what is wrong. Not saying there is a lot of wrong things out there, but what suits me, or what is the correct thing for me to do. Especially in a healthcare scenario, let's say other technology probably is not playing with my life and death, whereas healthcare, typically it's the question of your life and death. So when MVT, like your podcast, you get these experts here, and the patient gets the right advice, I think it takes it a lot beyond the podcast, and where it helps, and I'm hoping it will help affect their life in a very, very positive way, and it'll change their lifestyles as well.
Thank you so much. Thank you so much, Dr. Sushant, for coming here. You're enlightened us on the sleep aspect, which is, I think, widely ignored subject in the whole well-being of people. And we would love to host you again for maybe similar or different topic. So thank you again. And for the audience, again, I think this is something to think about tonight when you go to the sleep. And do not forget to subscribe our channel, Medical Value Talks, and look forward to hosting you again for interesting episode of MVT podcast. Thank you so much.
Thanks, Nitin. Thank you.